Ever wondered why our bodies feel strong and sturdy? It's all thanks to our bones. These unsung heroes not only give our body its shape, but also protect our vital organs. They're our personal bodyguards and movers, facilitating our every dance move, jog, or high five. And the secret behind their strength? Bone density. The denser the bone, the stronger it is. So, maintaining good bone health is crucial. But what happens when our bones start to weaken? Let's explore. Imagine a sponge. If it loses its density, what happens? It becomes weak, brittle, and easily breakable. Something similar happens in our body, a condition we call osteoporosis. Osteoporosis, derived from the Greek words osteon, meaning bone, and poros, meaning passage or pore, is a condition that weakens bones, making them fragile and more susceptible to fractures. Imagine your bones as a fortified castle, strong and sturdy. Osteoporosis, however, turns this castle into a fragile house of cards, ready to collapse with the slightest pressure. Often dubbed as the silent disease, osteoporosis can stealthily make a home in your body without showing any noticeable symptoms until a bone breaks. It's like a thief in the night. You never know it's there until it's too late. The most frightening part? It can happen to anyone, but remember, knowledge is power. Understanding osteoporosis is the first step towards prevention and treatment. In simpler terms, osteoporosis turns strong bones into weak ones, but how many types of this disease are there? Osteoporosis isn't a one-size-fits-all condition, it comes in different types. Let's delve into the two main categories, primary and secondary osteoporosis. Primary osteoporosis is the more common type, usually developing with age. It can be further divided into two subtypes. Type 1 or postmenopausal osteoporosis typically affects women after menopause due to a decrease in estrogen. Then there's type 2 or senile osteoporosis, which generally hits both men and women over the age of 70, when the body's ability to form new bone can't keep up with the rate of bone loss. On the other hand, secondary osteoporosis is less common and results from specific medical conditions or treatments like long-term steroid use that affect bone health. It can occur in people of any age, gender, or race. So, we're looking at a condition with different faces, each with unique characteristics. So, we've got different types of osteoporosis, but what causes them? To understand the causes of osteoporosis, we need to dive a little deeper into our body's workings. You see, our bones are not static structures, they're constantly undergoing a process called bone remodeling. This is a two-step dance between cells called osteoclasts, which break down old bone, and osteoblasts, which build new bone. This process ensures that your bones stay strong and healthy. But if there's an imbalance, with osteoclasts working overtime and osteoblasts slacking off, you end up losing bone mass, leading to osteoporosis. Now let's talk about the factors that can tip this delicate balance. Age is a significant contributor. As we grow older, our bodies naturally slow down the production of new bone. Women are more susceptible to osteoporosis, especially after menopause, due to a decrease in estrogen, a hormone that protects against excessive bone loss. Lifestyle choices can also play a role in developing osteoporosis. A diet low in calcium and vitamin D, inadequate physical activity, smoking, and excessive alcohol intake all contribute to bone loss. So you may want to rethink that third cup of coffee or the sedentary binge watch session. Certain diseases and medications can also increase the risk. Diseases such as rheumatoid arthritis, lupus, and multiple myeloma can affect bone health. Long-term use of some medications, like corticosteroids, can interfere with the bone remodeling process. But remember, while these factors can increase the risk, they don't guarantee you'll develop osteoporosis. It's more like a nudge in that direction. Understanding these causes can help us make informed decisions about our lifestyle and healthcare choices, aiming to maintain our bone health for as long as possible. Now that we know what causes osteoporosis, it's time to look at its symptoms. Osteoporosis may be a silent disease, but it does have some telltale signs. Just like a whispering wind that hints at an approaching storm, these symptoms often go unnoticed until they've made their mark. One common symptom is back pain. It's not the kind that comes and goes with strenuous activity or poor posture. This is a persistent, nagging ache that seems to originate deep within your spine. It's like a constant reminder that something isn't quite right in your body. Next, there's the loss of height over time. Now, We're not talking about a drastic change overnight. This is a subtle shrinking, a gradual decrease that might make you wonder if you're imagining things. But trust me, your eyes aren't playing tricks on you. Then there's the stooped posture. It's not a slouch that can be corrected with a quick straightening of the back. This is a permanent bending, a curvature of the spine that makes standing tall feel like an insurmountable task. Lastly, and perhaps most alarmingly, are fractures that occur too easily. A simple fall or minor bump might result in a fracture, signaling that your bones aren't as strong as they used to be. These symptoms might seem unconnected at first, but together, they paint a picture of a body struggling to maintain its skeletal strength. Knowing these symptoms can help us catch the disease early, but how do we treat it? Well, stay tuned, and we'll delve into that in the next segment. Osteoporosis might sound scary, but don't worry, there are ways to manage it. When it comes to tackling osteoporosis, there are several avenues to explore. The first step is often lifestyle changes. This could mean increasing your intake of calcium and vitamin D, two vital nutrients for bone health. Regular exercise, especially weight-bearing and muscle-strengthening activities, can also contribute to stronger, healthier bones. It's also a good idea to quit smoking and limit alcohol consumption, as these habits can weaken your bones over time. Now let's talk about medications. Several drugs have been developed to slow bone loss and promote bone growth. Bisphosphonates, for example, are a type of drug that slows the rate of bone thinning, while rank ligand inhibitors can help to increase bone strength. Hormone-related therapies such as estrogen therapy for postmenopausal women can also be beneficial. However, it's crucial to remember that any medication comes with potential side effects, so it's always best to discuss these options with your healthcare provider. In some severe cases, surgical treatments may be considered. These include vertebroplasty and kyphoplasty, procedures that help to stabilize fractured vertebrae, and spinal fusion surgery, which joins together two or more bones in the spine to prevent painful movement. The path to managing osteoporosis doesn't stop at treatment. Regular checkups and monitoring are key to ensure the disease is under control and to adjust treatment plans as necessary. Early detection is especially important, as osteoporosis often doesn't show symptoms until a fracture occurs. Regular bone density tests can help identify the disease in its early stages, allowing for more effective treatment. Remember, each person's journey with osteoporosis is unique, and what works best for one person might not work for another. It's important to work closely with your healthcare provider to create a treatment plan that suits your specific needs and circumstances. Treatment can help manage osteoporosis, but it's important to be aware of potential side effects. So, stay informed, stay proactive, and take charge of your bone health today. Every coin has two sides, and so does osteoporosis treatment. Like any medicine, osteoporosis treatments can come with some side effects. Common ones include nausea and abdominal pain, which are typically associated with bisphosphonates, a common type of osteoporosis medication. These discomforts can usually be managed by taking the medication with a full glass of water and remaining upright for at least 30 minutes afterwards. A more serious, but less common side effect is the risk of unusual thigh bone fractures. These fractures can occur with minimal or even no trauma in patients taking bisphosphonates for a long time. This emphasizes the importance of regular follow-ups with your healthcare provider to monitor your bone health and medication effects. Let's not forget that these side effects are not a given. They occur in a minority of patients, and there are many who experience no side effects at all. Remember, the goal of treatment is to help, but it's crucial to weigh the benefits against potential side effects. Osteoporosis isn't just a medical term. It's a condition that affects millions worldwide. We've journeyed through its complexity together, understanding its definition as a bone disease that occurs when the body loses too much bone, makes too little bone, or both. We've explored its types, primary and secondary, each with their unique causes and risk factors. We've delved into its causes, from hormonal imbalances and age to dietary factors, and recognized its symptoms: back pain, loss of height, and fractures that occur more easily than expected. We've also discussed the available treatment options, ranging from medication to dietary changes and exercise, and acknowledged the potential side effects that could arise. But let's not forget, knowledge is power. Understanding osteoporosis gives us the tools to prevent, manage, and treat it effectively. Remember, your bones are your body's foundation. Keep them strong, and they'll keep you standing tall.